It is my great pleasure to introduce Adrienne Asch from Victoria University, who's giving our second keynote address. Dr. Asch is the director of the Center for Ethics at UCIVA, and she teaches there and in the Albert Einstein College of Medicine School. She's very accomplished. I'm not going to go through all of the many things that she's done, but she's done very important work in the topic she's going to talk to us about today. The title of her talk is Selecting Our Children's Characteristics Before They Are Born, Implications for Family and Society. Please join me in welcoming Dr. Adrienne Asch.
Thank you. Thank you, Matt, and thank you, everybody. I've really enjoyed being here and getting to meet a lot of great people. And I hope that this talk will tie in, although it's, I think, probably somewhat different from some other things that have been going on here. I'd like to think it will tie into the general questions of values in science, medicine, technology. Can people hear me?
Yes.
Okay. I'm going to read you a few quotes from people, and then, but mostly talk this talk. And the basic question that I'm going to be focusing on is that of selecting children's characteristics. There are lots of different ways to do this. The best known is that of selecting against various traits such as disabilities, and I'm going to talk a lot about that because that's the most accepted form of selection. But we do a lot of selecting in other realms too. Some people think that when we mate we are selecting. I think that's debatable. We are selecting, but I'm not sure we're selecting based on the genetic characteristics of our future children. All of you who are parents can think about that. We do selecting in adoption. Not everybody, but a lot of people. I want a girl, I want a boy, I want an older child, I want a baby. I want somebody from Romania, I want somebody from China. There's been a lot of discussion, of course, about racial matching in adoption, some pro, some con. We do selecting if we use the gametes of other people if we're using assisted reproduction. So if we're a same-sex couple or a single woman or man or a straight heterosexual couple who have not succeeded with conventional intercourse or IVF, and we use sperm or eggs from other people, we are often selecting the characteristics of the sperm or egg provider, euphemistically called a donor, but in fact, very rarely are they actual donors. They really are mostly paid for the sperm and the eggs. So there's a lot of selecting going on. And there are discussions about this not only in the present, but in the future, if we get to the point where we can do what's known as genetic enhancement, and I know some people here are working on that topic. Shall we try to enhance our children? And if so, should we make it available to everybody, or will that engender more inequality in society than already exists? So there are lots of discussions about selection. But rarely are they discussed together. So people talk about selecting gametes, or selecting an adoption, or selecting an enhancement, or selecting sex, or selecting prenatally for disability, or against it primarily. And they're generally separate discussions. So the first point I want to make is that I'm trying to talk about them together, even though I will spend some more time on some of the forms of selection and less time on others. The basic question at issue is, should we be doing this? Okay? So, I seem to be vacillating between drinking coffee and not. Okay, so here's a comment about sex selection made about 20 years ago. Although sex selection might ameliorate the situation of some individuals, it lowers the status of women in general and only perpetuates the situation that gave rise to it. If we believe that sexual equality is necessary for a just society, then we should oppose sex selection. Okay, that was said by Dorothy Wirtz and John Fletcher in 1992. And the argument they made was pretty much that even whether we're selecting for the notion of family balancing, or whether we're selecting because we think that women get a worse deal in India, China, or even the United States than men, we want to give our children the best, we should select to try to have men. Or if in our dreams our first child is a girl and our second is a boy, or often it's the reverse that people fantasize about. So there are lots of reasons that people give for selecting for sex. But Wirtz and Fletcher want to say that even if abortion is legal and should be legal and should remain legal, and even if women should be able to make that decision for whatever reason they wish during the first 24 weeks at least, the idea of selecting based on sex is inherently disadvantageous, especially to women, but it's disadvantageous to a societal ideal of sexual equality and diversity in how women and men play out those gender roles that we know so well. So, the father who says, well, yes, I have 2 daughters and I really love them, but I'd love to have a son because I'm so excited about coaching Little League, or Boy Scouts, or, I want to see my son dressed in my clothes, or whatever it is. Or a mother who says, I really enjoy my boys, but I've always dreamt of raising a girl and showing her how to be a woman in the way that I think it's important to be a woman. What Wirtz and Fletcher want to say, and what a lot of other people want to say, is that when you do that, even though these seem very benign, you're reinforcing in your own mind and in the way you will wind up treating your children a notion of how girls and boys, women and men are supposed to be. So even if we're not talking about, egregious wrongs to women in India or China, even if we're just talking about the United States, sex selection is a controversial and, for many people, a troubling matter. Including people, now lots of people who would say that they believe in women's reproductive autonomy would say, we have to allow this for sex even though we want to discourage it. Some people would say, not to be quoted to the right, but they would say that, in an ideal world where abortion weren't in jeopardy, they might be more willing to oppose sex selection and try to stop abortion or selective embryo implantation. Okay, so here's a comment about selecting for homosexuality, which we can't do, but if we could, genetically, and we can't do it for one thing because there's no guarantee that sexual orientation has a genetic component. There are some people who think it does, but it's a pretty disputed question. But in this hypothetical, the very motivation for seeking an origin of homosexuality reveals homophobia. Moreover, such research may lead to prenatal tests that claim to predict for homosexuality. For homosexual people who live in countries with no legal protections, these dangers are particularly serious. Now contrast this with statements made about selecting prenatally or through pre-implantation genetic diagnosis, PGD, for disability. That has been a much more accepted activity ever since amniocentesis came into existence in the mid-1970s. And some people, I actually heard some comments yesterday from one conference participant that the tests were considered by her physician to be routine, and it was really expected that she would use them. So in 1988, a genetic scientist wrote, "Human mating that proceeds without the use of genetic data about the risks of transmitting diseases will produce greater mortality and medical costs than if carriers of potentially deleterious genes are alerted to their carrier status and encouraged to mate with non-carriers or to use other reproductive means." Written in 1988. Written some years later, attitudes toward congenital disability per se have not changed markedly. Both pre-modern as well as contemporary societies have regarded disability as undesirable and to be avoided. Not only have parents recognized the birth of a disabled child as a potentially divisive, destructive force in the family unit, but the larger society has seen disability as unfortunate. Our society, I'm still quoting, still does not countenance the elimination of diseased, disabled people. Note the still. But it does urge the termination of diseased, disabled fetuses. The urging is not explicit, but implicit. Okay. One wonders whether the writer of that passage thinks we should be getting to the elimination of diseased, disabled people. Okay, now, so those are the claims about particularly prenatal sex selection and disability selection and sexual orientation selection, and I'm going to talk about sexual orientation selection as an example of a non-medical trait. Right now, we can't test for musicality or mathematical aptitude or athleticism or risk-taking or nurturance, but perhaps we could at some point in the future. And we don't test, although it would be very easy if we wished to. This relates a little to, what I'm going to say here relates a little to Kristen's talk the other day about values in science. We don't test, we haven't developed tests for eye color. We could, but we don't, and we question why we haven't. I think the answer is that people don't consider eye color an important enough characteristic that we want to test for. We're not going to make reproductive decisions based on eye color, even if we have our preferences. But tests for a whole range, several hundred to several thousand characteristics considered disorders, whether they're metabolic or chromosomal or single gene or recessive gene, single dominant gene, are tested for, and we all pretty much know what some of them are, the more common ones: cystic fibrosis, Down syndrome, spina bifida, hemophilia, Duchenne muscular dystrophy, beta thalassemia, sickle cell disease. Those are among the common characteristics that we do tests for. Now, what are the reasons that people use, leaving the prenatal area, what are the reasons that people use to select the gametes? When they're selecting, when they can't use their own eggs or sperm, and they want to get somebody else's gametes to produce a child. People know about the internet catalogs, and they where you can look at profiles and read about the providers, donors, and look at photos and choose all sorts of characteristics. And there have been ads for acquiring the eggs of a woman who is 5'10", a chess player, a cellist, has 1,500 SAT scores, went to Stanford, that kind of thing. And the reason that people give, all right, so what are all the reasons that people give for selecting? Philosophers and often prospective parents would say, look, we're going to do a lot to shape our children after they're born. We're going to try to pick their schools the best we can. We're going to worry about their friends. We're going to feed them good food. We want our children to succeed. We want our children to start out with the best they can in life, and then we want them to have, some people call it a competitive edge in a competitive society. Some people say they just want to make sure their children do well or aren't disadvantaged compared to their peers. And a lot of people say, if we are going to do these things after birth, what's wrong with doing them before birth? We want to have our children start out with the best for the same reason that we want to give them the best later on, the best that we can do. Now, I think that's the general argument for selecting. There's another argument for selecting, which is parenting is a hard job. I don't know that anybody would disagree with that. And the more you can make things favorable, whether it's having a child that you think is going to be similar to you in important ways, or different from you in important ways, the better you think you'll succeed as a parent. The more attached you'll be, the easier time you'll have, the greater bonds you'll have, the more you can help shape your children in the way that you think they should be shaped. Similarly, people would say, look, society values some characteristics and not others, and we want children to have the characteristics society values, whatever those are. So I think those are the reasons for selecting. Now, I want to offer some critiques of selecting. And there are several. And they run in different, there are different kinds of critiques. Some have to do with the parent-child relationship. Some have to do with the nature of society and what I think values we want to have in society. Some have to do with the effects on currently marginalized groups of selecting particularly against the potential of having more members of those marginalized groups, although that is, I think, the least important part of my argument. So the first point I would make about selecting, and this is in the prenatal or preconception context, is that selecting for or against a characteristic turns whatever the characteristic is that we're selecting for or against, whether it's the chess playing potential or the intelligence or whatever it is, into a characteristic, the most important characteristic of a future person, and abstracts a characteristic from a whole person. So, in fact, as contrasted with people who say that this argument, that the argument against especially sex or disability selection is about sex and disability as a central part of identity, it's actually not about whether sex or disability are a central part of identity. It's saying that no characteristic has to be or should be made to be a central part of identity, that's something that persons get to do. They certainly don't do that alone. They do that in interaction with others, and how people are treated will affect whether a characteristic becomes an important part of someone's identity in their own minds. But it's an interactional process. So the argument against selection and synecdoche is an argument to say no one characteristic for the parent or the future child should have to play such a dominant role in thinking about identity and thinking about what a whole person is. And that for a person, a child in developing, that characteristic, whether it's Down syndrome or spina bifida or femaleness or a particular mathematical aptitude or sexual orientation, whatever that characteristic would be, there's no way to know in advance how important that child will feel about that, will feel that characteristic is to him or herself. Parents will play a role in that. Social treatment will play a role in that. But selecting for or against a characteristic makes that characteristic much too important before the child, as an individual person, gets to make any decisions about how she or he views it in her or his own life. And that's one of the differences between selecting pre-birth and selecting activities post-birth. So a friend of mine, for example, who's a very passionate cellist, not a professional musician, spent the first 10 years of her daughter's life playing the cello for her daughter and getting her daughter cello lessons and taking her daughter to concerts and seeing young people play the cello. Her daughter hated the cello. Hated the cello. Now, her mother is a very forceful person. And she persevered for 10 years to try to get her daughter to like the cello. But finally, this young woman said, you know, fine, I like you a lot. I don't like the cello. I'm not playing it. Forget it. And so we can do a lot. And parents, there's no particular reason why parents shouldn't do a lot to try to inculcate, whether it's a religion or values or preferences or interests or activities for their kids. But in the post-birth situation, a kid gets to say at some point, thanks a lot, but no thanks. I don't like it. I don't want it. I'm glad I got exposed to it. I'm rejecting it. And that can be, of course, very painful. But that's the difference between the pre-birth and the post-birth kind of shaping activity. And so I think the people who want to say if you're going to do things post-birth, there's nothing different from doing them pre-birth. I think that's not true, because it becomes much harder to ignore for the parent and the child a way that the child was intentionally shaped by gametes or tests before birth. So one large point has to do with how important any one characteristic should be. Another objection that I would want to raise to these forms of selection is an objection about how much genes matter anyway. Now, I don't think I can resolve this. Behavioral geneticists can't resolve it. It's still up for debate. How much are we our genes? There used to be, even 25 years ago, a group of behavioral geneticists who wanted to say we were our genes. There are books that say our genes, us, and James Watson is quote reputed to have said, we used to think that the fate of our selves was in our stars, and now we know it's in our genes. Even behavioral geneticists now want to acknowledge a complex interaction of multi-factors, multi-genetic conditions, and environmental conditions. So, although there are some characteristics, Huntington's disease or cystic fibrosis, that we can trace very particularly to genes, exactly how much of any other characteristic than some of the genetic disorders we can trace to genes is certainly not at all clear. And I think the notion that the egg you get from the woman who is a chess-playing cellist is going to produce a cellist and a chess player, or even a violinist and a bridge player, I think is really dangerous. It neglects the role of environment. It neglects and gives much too much room to a kind of genetic determinism or genetic essentialism. They're not exactly the same thing, but it certainly is a way of making genes much more important than I think they really are. Now, in the disability context, particularly, where it is least controversial to select against Down syndrome or cystic fibrosis, the same authors, Dorothy Wirtz and John Fletcher, who decry sex selection, were, in their writing for years, major proponents of disability selection, and found the critiques of selection totally unconvincing, and felt that disability was completely different from sex. That disability was equivalent to suffering, misfortune, cost, burden, drain on society, hardship for family. And that although the implications of eye color or sex or even sexual orientation might be variable, most people, and this is very much true within the medical profession, very much true within the elites of geneticists, very much true within the field of bioethics, that disability selection, at least, is uncontroversial because there's an assumption that we know what disability is and it's bad. And as Watson said, yes, there are those exceptions, and there are people who thrive despite their handicap, but they are exceptions, and we should acknowledge that, and disability is really bad for people, and everybody should stop being politically correct and nice and say anything otherwise. Well, I think that that's really based on a great deal of misinformation about the lives of children and adults with disabilities and their families. And if we're going to do selection, it needs to be based on clear, rich information about the lives of people with disabilities as children and adults. Despite things like the Rehabilitation Act and the Americans with Disabilities Act and the Individuals with Disabilities Education Act, I think that we have not made the kind of social progress that one might like in terms of disability and inclusion and comfort with disability as a form of human variation. And I have to thank UT Dallas's Richard Scotch for a very important article discussing the human variation model of disability that has been very influential in my own thinking and characterizing disability, and probably not as influential as it ought to be. But and the question is disability legitimately another form of human variation, or is it, as the medical profession says, something that we want to eradicate and should eradicate? Now, this is where pre-birth and post-birth also become very important. So, Dan Brock, for example, who is a strong proponent of prenatal testing, and in 2005 published an article saying that it was morally required, not morally permissible, but morally required for selective implantation and selective abortion of embryos or fetuses found to have characteristics of moderate retardation or blindness. Those were his examples for the article. He would have applied this to pretty much any disability, but those were the examples in the article. And he said it's completely compatible with the idea that you can have an okay life if you have moderate retardation or blindness, but all things being equal, it's better not to be those things, and no parent who loves her or his child should want to bring into the world someone who is going to have that characteristic when a test and abortion or selective implantation will avoid that. Treat people nicely once they're born, but and enforce their civil rights once they're born. This is Brock. But if you can avoid their being born with those characteristics, do so. Now, at the end of this talk, I'll get to the question of is his idea, he believes that his idea has no contradiction. I'm not sure he's right, and I'll try to talk about that. But let's go to the pre-birth question here. Most people with disabilities, along with most people without disabilities, go to doctors for the flu, a broken leg, the things that happen in life. You have one disability, that doesn't mean you don't want to treat another health condition. But what's the difference between, again, treating a condition and preventing the existence of someone who won't come into existence without that condition? It can be fine to want to restore capacities or improve capacities, but that's very different from saying, and if you don't have capacities, or if this fetus or embryo isn't going to have those capacities, that fetus or embryo shouldn't come into existence. I think that's a very different statement. And that's not really about the moral status of the embryo or the fetus. That's about the parental kind of project of when does one start thinking of oneself as a parent. Now, some people want to say that the start of thinking of oneself as a parent is after birth. But in most pregnancies, the women and men in the couple, or the two women in the couple, or the two men in the couple who have arranged to have someone carry a child for them, in most pregnancies, everybody's quite involved in thinking of that fetus as a new baby, a new member of the family. They've started that parental project, whether it's painting a room, whether it's getting a different house, and if you have the money, getting a house with a room, if you want to have a child in a room of his own, whether it's picking a neighborhood where you think there'll be other young families with young children, or old families with young children, whatever people do. The fetus, and in the assisted reproduction context, the embryo, because there's so much work in getting that embryo, the parental project starts when people decide they want to be parents. And so I think it's very different to say, I want to be a parent, but only of a particular kind of child, from I don't want to be a parent at all, or I don't want to be a parent now. Than to say, I do want to be a parent, and I want to be a parent now, as soon as I can, but only to a child with some particular set of characteristics. That's what some of us have referred to as the any particular distinction, and said that the abortion of any fetus is different from the abortion of particular fetuses for particular characteristics. That there's a moral and a psychological difference in that second kind of abortion, and one that I think is more troubling, not because abortion isn't ethical and shouldn't be legal, but because there's a different act going on there. So again, pre-birth, and this would go to the sex selection and the gamete selection, people who go to a great deal of trouble to find egg and sperm providers are not saying, particular egg and sperm providers are not saying they want to be a parent. They're saying they want to be a parent to a child who they hope will exhibit some particular set of traits. Now, the question that I want to raise here is that compatible with a notion of parenting that we want to support? I'm not sure it is. Michael Sandel, in a pretty famous article in 2004 and then a book in 2007, differentiates between accepting love and shaping love. He argues that children should be seen as gifts, and that parents need to balance their notions of shaping a child with accepting a child. Now, he does not go as far as I would go, because he stops short of the disability context, but he's talking about the non-medical traits primarily, and warning against genetic enhancement and certain forms of gamete selection. He's pretty clearly not saying that his views about accepting and shaping go to the disability context. He's really talking, as I say, only about what he considers non-medical traits. I reject the gift language. I don't know that children are a gift. They might be, but I'm not sure who's giving that gift. I think it's more comfortable for me to think that parenthood is a mix of, it's undertaken for a whole lot of reasons. If you look at the reasons that people say for why they have children, they include everything from wanting to pass on family heirlooms and family names to wanting to rediscover their own childhoods, or wanting to repair their own childhoods, or do all the things their parents didn't do for them, or do all the things their parents did for them, or and I don't think it makes sense to say that parenthood either is or should be or even could be some exclusively selfless, altruistic act. It's too hard, too long, too complicated. And I'm not sure that selfless makes sense there. You're investing yourself in the ways that you think about raising your child. That's what a lot of what parenthood is. But I would argue that the notion of parental love is, at least in the ideal, and then it's everybody's job to, if we accept the ideal, and not everybody does, but if we accept this ideal, it's not only trying to shape our children to be good or virtuous or talented or successful or fit into society. It's not only protecting them from physical danger and psychic harm, it's fostering their qualities as unique individuals. It's appreciating and valuing them for their individuality, for the ways that they are different from us as well as the ways that they are similar to us. And I think that if we lose that as a notion of as a parental ideal, I think we will lose something valuable in what we think a parent-child relationship is. In a conversation, in an article about prenatal testing, that's a dialogue between Eva Feder-Kitay and her son Leo. Leo is the brother of a now adult woman with a disability. He says to his mother, I don't think families should be like clubs. They shouldn't have criteria of membership. If they have criteria of membership, they lose something about what a family ought to be. Family, in his view, was a family that appreciated or nurtured people with a range of characteristics. And the shaping that's done prenatally, preconceptually, I think is inimical to the love and appreciation value that I'm suggesting. I'm hoping people will talk with me about that. There certainly are, this is a controversial notion. There's getting to be more discussion within the philosophical literature and the bioethical literature about what's important in family life and what parental love should consist in. Now, it's this notion of club that ties the family, I think, to the society. The society that we live in, first of all, is working toward, at least in the United States, it's working toward greater acceptance and appreciation and social and political and economic equality for women and men, for gays and straights, for people based on their, regardless of race or ethnicity, and for people with disabilities. And because people are going to vary along those lines, pretty much, disability, for example, is a characteristic that increases with age. Even if we could diagnose and prevent the birth of every potential child with a disability, that would eliminate only 1% to 2% of the disability in the population. Most disability increases with age. It's Lots of disability is not prenatally diagnosable. Lots of it will never be prenatally diagnosable. Even if there are determined to be genetic components in cardiac disease or type 2 diabetes or arthritis or bad backs, or all the kinds of things that plague middle-aged and older adults. Unless we're going to screen out everybody with those characteristics prenatally, in which case I'm not sure who's going to get born, we're going to have disability in society. That is just a fact of life. And the longer people live, the more people with disabilities or chronic illnesses, I'm really going to talk about them together because they're all considered disabilities within the legislation of the Americans with Disabilities Act and other major civil rights and acts that affect people with disabilities. So disability is a part of society. We have a society that at least de jure is interested in more equality, more participation, more opportunity for people regardless of impairment. If we recognize that many of the barriers to the participation of people with disabilities have been socially created and are socially remediable, then we have to question, well, is the solution to disability prenatal diagnosis and selective abortion of everyone with a congenital prenatally diagnosed condition, or is it the greater enforcement of civil rights and education laws and the hailing of health reform to give people more health care? And think about the difference between what genetic counselors, what health practitioners say to people about, do you want to bear and raise a child with cystic fibrosis? And there are a lot of data to suggest that even now in 2013, people are talking about the burden of cystic fibrosis. They're talking about the tragedy of cystic fibrosis. They're not, lots of people aren't even up to date with the fact that people with cystic fibrosis can now live into their 30s, 40s, 50s. Some die earlier, there's no question, but lots of people live well past young adulthood. With cystic fibrosis, people are going to school, having jobs, having lives, getting married, having children of their own, some of them. And that's true for most people with most disabling conditions that can be diagnosed prenatally. Now, not all. Some are very profound. Some are lethal early in life, but that is not the bulk of prenatally diagnosable disability. If we're interested in a society that promotes equality for people with disabilities and promotes the participation of people with a whole range of characteristics and is interested in reforming itself to accept a notion that people come in literally all shapes and sizes with all kinds of variations, and that the job of a society is to promote inclusion of people with all of their characteristics. If that's the goal, is that compatible with a notion of screening and preventing people from coming into the world because they have those characteristics? I'm not sure that it is, especially as it's currently practiced. Now, Dan Brock is one of many people who wants to say that it is compatible, that in the pandemic, for example, in the coming pandemic, when there's raging flu and there are not enough ventilators for everybody, and people are going to have to decide who's taken off those ventilators. He doesn't want to see disability used as a reason, pre-existing disability as a reason to take people off the ventilator. But he does want to say, as I say, he does want to say if you are going to have those pre-existing disabilities, you shouldn't come into the world. But once you're here, we're not going to take you off the ventilator if you need one. Is that stance internally contradictory? I think at the moment it is, and I think at the moment it is for this reason. It goes back again to something Kristen was talking about what research we do and what we don't. We test for some characteristics and not all. The American Society for Reproductive Medicine urges the testing and termination of pregnancies found to have fetal abnormality. It's much more wary about the testing and termination for sex. It won't oppose it, and the American Society for Reproductive Medicine is not a legally enforcing body anyway. It gives only guidelines for infertility clinics. But its opinions matter to the doctors in those infertility clinics and shape their practice. And so they're very clearly on the side of testing and termination for one set of characteristics and opposed to testing and termination for another. What I would want to argue is if we want to promote a kind of equality and recognition and appreciation and inclusion of people, then we either have to select for anything, whether it's tone deafness or deafness, eye color or blindness, select for the person who's going to be 7 feet tall, or select for or against a person who might be 3.5 feet tall. Let prospective parents select for whatever they want. Select all the gametes you want, select for sex, select for whatever disabling characteristics you want to select for or against. If you want to select for eye color, go ahead. And furthermore, if we think it's legitimate for parents to select, then we have to decide whether the society is going to pay for all these selection techniques and whether we're going to spend the money to develop them. If we don't, then I think the society is more implicated than it wants to be in a word that nobody likes, which is eugenics. Everybody wants to say that gamete selection and sex selection and prenatal disability selection are not eugenic. We're not the Nazis. We're not even the Americans of 1910. This is not Buck versus Bell, 3 generations of imbeciles. This is all private decision-making. But it's not private decision-making only. It is very much affected by what elites say, what tests geneticists develop, what values are behind the development of tests and the promulgation of standards for genetic counseling, what is taught in medical schools about disability and other characteristics. So if we want this to be not a kind of list of what's acceptable and what's not, far from banning the technology, let many thousands of flowers bloom and many tests test and many tests prevail, and I'm not sure we'll like the results, but at least we won't have a list of things and characteristics that are beyond the pale and things we think are beyond the pale to test for or against. So, do I think that more people will test for deafness than tone deafness? Yes, but if it's equally acceptable to test for tone deafness as it is for deafness, then that really will be a private decision. If people get, and it's hard to do, but it is possible to do, to give rich and balanced and thought-provoking information about life with a range of characteristics, then parents can make their decisions about what gametes they want what sex of a child they want, how they feel about a child with a disability, knowing something that's more accurate than they now have about life with particularly the disabilities that can be tested for, when most parents or prospective parents have never met people with the disabilities that are tested for and have frightening TV images or frightening medical images or no-age images, whatever, to try to make decisions about are you prepared to raise a child with Down syndrome or spina bifida when you don't know anything about it. And when you talk to people in even current-day genetic counseling programs, genetic counselors being the people who are supposed to give prospective parents information about the tests and the conditions the tests test for, genetic counselors will tell you that they've never in their training met people out of a medical setting who have disabilities. That's not part of the training. That's not what they're told about. They're told about clinical contexts. They're told about risks, and that's the word risks. They're not told about probabilities. They're told about risks of bad things and burdens. They're not told about the families who thrive well with people with all kinds of characteristics. And when the genetic counselors and the medical elites and the geneticists have the kind of ideas about what it means to have one set of characteristics as opposed to another, we're not creating the families that I think we want, or the society that I think we want, that is interested in nurturing people regardless of their characteristics. Thank you.
Hey, questions? Jessica.
Adrienne, thank you so much for that talk. I will admit, I am the person she was speaking to yesterday. You might be able to tell. So I have two comments. The first is that one of the things that you point out, and I think is really important, is just how normalized the prenatal testing is. And so I was never asked, because as you can tell, I'm a geriatric pregnancy, how old I am. I was never asked whether I wanted the first set of tests that tested for my risk factors for Down syndrome, I think, and a couple of other things. So then by the time you get the results and they give you the scary numbers, and this gets to my second comment, just a few weeks ago it was National Leave Your Kid at the Park Day. I don't know if anybody remembers this. So what you are supposed to do, because there's so many helicopter white middle class parents, that the better way to deal with this is to leave your children at a park and leave. Just go away and leave them all alone there. And so we were talking about that and how statistically they're probably safe, right? Statistically, nothing's going to happen. But the thing that could happen is so horrible to them, right, that you think, well, I can't leave my kid at a park, because if that does go wrong, that's going to be terrible. And what the doctors usually present this stuff as after they come to you with your risk factors, which they've done in a blood test that they also took cholesterol levels and didn't tell you was testing for genetic stuff, they come back and they say, well, if your child is born with cystic fibrosis, for example, he or she could die really early, right, like at 3 years old. And so they present these kind of really horrible scenarios that, sure, statistically, right, the child could be born with CF, and there are real possibilities that the child could live till the 30s and 40s and have their own children, have perfectly rich and great lives. But what my doctor just told me was that he could die when he's 3, a very painful death, and have had, and so I think the problem is in information, maybe, right? Yep. But also, even with that rich and balanced information about the life of a person who lives with different abilities, I think that there has to be something else too. Do you know what I mean? Maybe less scariness?
Yes. Well, first of all, I mean, there's no way that I could cover all the things there are to say about this in an hour. I've actually been at this and related topics for a frightening number of years. And I'm still trying to get it right. Yes, there's there needs to be less scariness, there needs to be more what I call balanced information, and it's a trick to figure out what balanced information is, but I think we actually, it's not such a trick. There's a fascinating article that was written some years ago, contrasting the pamphlets and messages given by doctors to parents prenatally about Down syndrome and cystic fibrosis and to parents with infants who are born with that condition. And the pediatric messages are all about activities and going to school and riding bicycles and doing ordinary things, and the prenatal messages are all about hospitalizations and early death. These are the same conditions by the same doctors. And so one has to wonder, are the doctors just trying to help the parents and their kids make lemonade out of lemons, or what? If you're going to give balanced information, you need to tell people about the potential of early death for somebody with cystic fibrosis, and the fact that they may go on and have a job and have a family and live very rich lives. And are they going to live to 70 or 80? Probably not at the moment. But can they live to 30 or 40 or 50? Yes, many people do and are. And then the question is, what's going on in the lives that they're living for however long they're living, not necessarily how long are they living. Yes, it has to be less scary. And then there's a lot of research that I think that needs to be done. You know, we do have an IDEA. We do have an ADA. We do have more young people educated alongside people with disabilities at the K through 12 and the college level. Is that changing people's attitudes? I'm not sure. Is that changing people's sense that disability is part of the, quote, normal, ordinary, everyday human experience? I'm not sure. I'd like to think it is, but I'm not sure it is. If not, why isn't it? If so, what does that mean about the people in their now 20s, 30s who are thinking about contemplating testing? Will they have less scariness around those characteristics and less reason to test against them? Not only because of information they get, but because of their own prior experiences. The data about siblings and family members of people with genetically diagnosable disabilities is that they are much less interested in testing than people who know nothing about the disabilities that are being tested for. It's not one for one. There are some people who are raised with people who have Down syndrome who feel they had a terrible experience and don't want to have a child with Down syndrome or cystic fibrosis. But most people, when you study siblings and family members of people with genetic conditions, they are not interested in testing because they actually feel that the person with that condition has led an okay life and that they can imagine raising a child who will have that life. That speaks to information and experience making a difference.
So I really like what you said about the parental project. And so I'm in fact sympathetic to your point of view, but let me play the devil's advocate here. So I think that for a lot of parents, they're conflicting intuitions with, during pregnancy. So for instance, the minute I know, I'm a parent of 2 kids, small kids, and the minute that we found out that we're going to have a baby, we started shopping with books and thinking about names. So really the parental project starts very early. But that is consistent with my philosophical, I guess the question, is it consistent with my philosophical position that during the first trimester, we're not dealing with personhood, so I wouldn't, I'm not opposed to abortions in general. And so I think that when bad news comes about, say, a certain condition, that parents are going to revert back to the standpoint that, well, the parental project hasn't started yet because we're really not dealing with a person yet. Although, again, practically, I think we might not be terribly consistent with this view because even people who really think that personhood really doesn't happen after birth still engage in the parental project much early. So do you think it's an inconsistency or?
I'm not sure whether you're saying that people are inconsistent or I'm inconsistent or
Well, I guess I'm saying that, if you're saying that parental, being a parent starts a bit early, then starts during pregnancy, and we should hold people to higher standards even during pregnancy. I think what in people's minds what's happening is that they revert back, if they find out some unwelcome news, they revert back to their sort of philosophical position that, well, not really, because the child is not a person yet. And so I think they feel easier, it's easier for them to deny that the parental project is on its way.
I think that's right. But I don't think it's so much about personhood. I'm really not sure that pregnant women and their partners are sitting around saying, the fetus is a person, the fetus is a person, the fetus is not a person, the fetus is not a person. They're saying, do I want a baby or do I not want a baby, or have I picked out a name yet? They're not labeling, baby B as a person or not a person. They're just imagining baby B.
I think that's the case when everything goes right.
Right, but when what you call bad news comes, well, first of all, is it bad news?
Well, to what people perceive.
All right, so let's agree that people perceive it to be bad news. So one problem is there a way for it to be presented as news, but not necessarily bad news? News that people have to think about. But isn't that what people should be thinking about before they begin contemplating being parents? I mean, lots of children, some children are going to have disabilities, and children are going to be different from what their parents hope they are, if not at birth, then by age 10. I mean, are parents ready for that? Is that part of what the parenting education ought to be about? The parenting reflection, the sort of internal dialogue people engage in? I think it is. Now, that doesn't mean that every prospective parent should or will say, I'm ready for any child and I'm happy to have any child that comes. I think with good information, it makes sense for prospective parents to say, here's what I think I can handle and here's what I think I can't handle. Now, they might be right or they might be wrong about themselves, but give people good information about all kinds of things and let people make decisions. I mean, I'm not saying ban the technologies, and I'm not saying, I would love to see people do less testing, less selecting, less gamete selecting than they do, less selecting in the adoption process. But if there's more self-reflection and more aid in the self-reflection process by medical professionals and other professionals and counselors who are there to help people, then I'm willing to let people do what they do. But I think it could be done a lot better. And yes, I think parents, prospective parents, will very likely revert. They'll say, I don't know exactly what they'll say. They'll say, there was a book written in 1986 called The Tentative Pregnancy by a sociologist named Barbara Katz-Rothman, who studied women contemplating using prenatal tests. And the book, The Tentative Pregnancy, was about how women felt that the advent of testing and the fact that they felt they had to make reproductive decisions following test results meant that for them the pregnancies became tentative until those results came in. So that would suggest that the parental project for these women started after they got news that they thought they could live with. Well, we can decide that we want to change our ideals about what parenthood is. I'm still clinging, perhaps, to some ancient notion that parenthood is accepting people as best we can for a whole variety of things, of who they are and who they aren't. And there's a new, very long, popular book called Far from the Tree that a lot of people talk about. And Andrew Solomon looked at parents raising kids that he described as far from the tree in a whole variety of ways, sexual orientation and disability and a whole lot of other characteristics, children who were the products of rape, to see how the parents felt about raising these kids. And although I think there are a lot of commendable things about that project, and his trying to recognize that disability or sexual orientation are among the characteristics that can make a child different from the parent, and maybe they're especially obvious markers of difference, but I think every child is different from every parent. And so in some ways, children are all both far from the tree and near the tree.
Thank you.
Nelson.
I guess mine is a two-part question.
You have to speak louder.
Mine, I guess, is a two-part question. One being, how much do you think that belonging to a consumer society kind of informs these choices of selecting and deselecting traits? And then as a consequence of that, the traits that are being deselected for are obviously being devalued and considered other. But how does that, by making people kind of a model that you can select and design for, how does that devalue everybody? Or do you have any thoughts on that?
How does that devalue everybody?
If we're being informed by like a consumer attitude towards now humanity by selecting and deselecting different traits, I mean, that might not be how any of these decisions are informed. But do you think that is an aspect or a part of this? I mean, I can select how my house is, I can select how my car is, I can even select, what's in my food and how it's made. And now I have an option of selecting what traits my children might have. Does that not kind of turn them into a consumer product?
Well, yes, I think it does. I mean, it turns. I mean, that's language that's often used. Turns them into consumer products. I haven't used that language in this talk, but I don't know that it's antithetical to what I'm saying. I'm interested in seeing children as important individuals in themselves who are going to have their own interests and their own preferences and their own autonomy, and that the job of parents is to foster that. And I think children are not works of art. They're not homes. They're not toasters. What else? What else are you looking for in that?
No, I was just wondering if you thought that was one of the things informing these decisions, and it seems that you agree that might be problematic if it's not, or if it is.
Well, I don't know that no parent wants to think that their child is a toaster. And no bioethicist who's writing about this and supporting selection wants to talk about children and toasters in the same sentence. They want to say, why not the best? Why not give your child the best? It's a competitive society. It's a tough society. It's a tough life. Give your child the characteristics that are going to help your children flourish. That assumes we know what characteristics help children flourish. I'm not sure we do entirely. Or that everybody needs to have the same characteristics. But yeah, I think there's a kind of consumerism about, especially the assisted reproductive technology industry. I know we're going to hear some more talks about this later, and that's why people talk about the infertility industry as an industry, because it's largely unregulated and driven very much by money and available for people with money, and infertility services are a consumer good. And gametes cost different prices depending on what characteristics the sperm provider who has a medical degree from one school gets more money than the sperm provider who has a medical degree from a different school.
Okay, Nikolai.
Thank you so much for your talk. I very much enjoyed it. I do want to point out a tension between 2 points that you've made. The first one was the important distinction regarding traits between pre and post. And the pre one you mentioned, there's something important there. They are intentionally shaped. Unlike the others where the kids could have something to say, I don't want to play this instrument or something like this. Then you moved on to your second point, and you quoted the very unfortunate thing from Watson, which most biologists would say is fairly untrue. And you warned us about the fact that genetic determinism, most biologists now would say it's flatly false. So part of what I'm asking myself is, if genetic determinism is flatly false, how can I really shape traits? Because the only thing that I select, how can I really intentionally shape traits? Since the only thing that I select is genes, but we know that genes, we just said it, don't really determine things. So how do you feel this kind of tension between, on the one hand, genetic determinism is false, but on the other hand, we can somehow still intentionally shape things?
Well, I mean, first of all, there's the fact that people think that's what they're doing. And that's what they're trying to do. So to the extent that genes play some role, I'm not saying they play no role. We know that genes play some role in some things. Exactly what role and exactly what things and how much of a role and how much of that is affected by other genes and by our environment, that's up for grabs. But
I fail to see where's the intention, because I don't know what's the relative contribution.
So then why are people going to such trouble?
Because they don't know enough biology. They should open a book and read more biology. But I don't see why.
Statistics, they need to know more about biology.
But even statistics, if they know, the analysis of variance, it's a population kind of claim. It's not a population, it's not a claim about individuals. I can make a claim about the relative contribution of genes and environments regarding the height of women in America. 60% is due to gene, 30% is due to environment. But that doesn't say anything about, that doesn't say anything about Katie Couric. Doesn't explain anything about Katie Couric's height. I think I'm not so sure. I think part of the debate for me, this idea that we can somehow select those fancy things, is, guys, just open a good biology book. Just go back, here's the textbook, and once we have that, probably half of the debate on selection will lose some of its force. And
that might be true. I mean, it's very curious. I don't know how many of you are familiar with the book From Chance to Choice by Buchanan, Brock, Daniels, and Wickler. It has been a pretty influential book. And there are 8 chapters of their book. I mean, there's one chapter that has the title, Why Not the Best? And there are some really quite astounding passages in that book about how we can, there's nothing wrong with trying to help endow children with genes that we think will make their lives go better. And then there's an appendix in this book written by Elliot Sober, a serious behavior geneticist, philosopher of science, who says all the things that we know about how complex the role of genes is in life. And the philosophy is really not in tune with the appendix of the book. But I haven't seen anybody point this out in reviews, but I do think it's quite fascinating. The book is all about the philosophy of genes and justice, and the appendix is a real disclaimer. But Buchanan, Brock, Daniels, and Wickler are very influential philosophers at very influential places. And
I agree with you. I think this is why probably at least out of the 4, Daniels changed his view. And in the last book, edited on human nature, he takes more of the route that Sober develops in the appendix of Chance and Choice.
I liked your insight about the fact that as we age, and as an aging person, I can see this, that abilities change and things like accommodations are necessary, and that the whole society essentially becomes needing different kinds of environments to function well. And then, of course, there's things like auto accidents and things like that. So even if we selected out genetically certain disabilities, that, in fact, the infrastructure that we're building for civil rights and for helping people who have any kind of difference, I think it would be a disservice to those people, because we wouldn't have the same kind of infrastructure that's built when we start accommodating people from an early age. So it's sort of, I think could be, I can't think of the word, not self-contradictory, but it would make things worse rather than better for everyone. It's just a comment. So,
I'm waiting for the tomatoes.
Okay, Martina.
So I wanted to ask a question about how to think about differences between problematic forms of selection, less or non-problematic forms of selection, and maybe relatedly sort of therapeutic interventions. And so at various points you introduced a number of distinctions, a prenatal, postnatal distinction between sort of genetic tinkering versus sort of behavioral interventions, interventions children can't control or respond to, and then some they can reject. And so maybe I just giving some examples. So I've got some friends who are musicians, and they want their child to develop perfect pitch. So they're doing all this sort of odd sort of music training right in utero. And that seems odd to me, but it doesn't seem as wrong as other sorts of interventions. Prenatal vitamins seem totally okay to me, though I might be weirded out by vitamins, by sort of prenatal pills that would develop very particular traits. And then, of course, there are lots of postnatal interventions that could be very powerful as well. And so I'm sort of interested in how you think about demarcations between different degrees of problematicity of these interventions in selection.
Well, I mean, I'm not sure what to add to some of the things I've already said, but let me try. I mean, I teach at a university that has a lot of was originally designed for Orthodox Jewish undergraduates. Now, anybody who knows about Orthodox Judaism will tell you it's a pretty shaping environment. You want to leave that environment, you're going to have a rough time. And you have characteristics that environment doesn't like, and it's not a pretty picture. There's nothing genetic about, the shaping that's going on in that environment, it's very powerful. Plenty of non-genetic things shape people. So, I'm interested in both respecting communities and respecting the fact that parents do want, people have kids, among other reasons, because they're hoping to influence a new human being. That's part of what the fun is, and the hope is. That they like their lives, they want to give a child a life that they think will be similar to theirs in some way, or have a lot of the things they value. So whether it's Orthodox Judaism or Catholicism or being a member of a family string quartet or who knows what, that's what parents want to do. Or that's what some parents want to do. Some parents are maybe more laissez-faire. And so it's not that I think the only shaping activities are genetic. But what's I'm not sure I'm getting what your question is.
Well, so maybe I'm in particular talking about this question of how selecting particular traits makes that selected trait the most valuable characteristic of the child and abstracts away from the individuality of the child. And as you say, there are ways in which you could try to do genetic selection, but there are other ways you could shape it, but you can do it not just after the child's born, but also in utero. And I'm just sort of thinking about rough ways to try and categorize or think about problematic ways of selecting traits, right? So, my friends who want their baby to have perfect pitch and are doing all this weird in utero music training, are they abstracting away from the individuality of the child?
Yeah, potentially. I mean, what are they going to do when their child either doesn't have perfect pitch or hates music?
Yeah.
One way to think of it might be things that are incidental, and have a very, explain only a tiny bit of the variance, like the prenatal vitamins or playing Bach by the mom's belly, and abortion, which is kind of final. So we could imagine a kind of continuum of interventions, and some of them are not that profound and may not have any real, may not matter much, and others are very, very serious. And so that where you are located on that continuum might have some moral difference if what it is.
Is it quick, Mark?
Well, it might be, I don't know. This is open, and I want to go to the other extreme just for a second. Another extreme, and this has to do with a subject I've been interested in for a long time. You mentioned flourishing with regard to the child, and I actually want to take it in the other direction. When parents find out that their child is going to be anencephalic, when they find out that their child is going to be born basically with only a brain stem, they usually select to actually bring the child to term. So you have this kind of odd form of selection wherein the child is going to be born and usually live at a maximum to 10 days. And I'm curious, it's a really open question. I just really like to know where that kind of selection falls in, especially if the idea, and it's usually the parents who are the ones who actually want to lobby for donating the child's organs and tissues and so on and so forth. I'm just curious where that falls into all of this, because then we're talking about not the child themselves flourishing, but the child as this very interesting kind of agency that's going to help others, right?
Right.
And I'm just wondering if you could speak to that. I'm just very curious about what.
Well, that's interesting. I mean, I don't think that's quite in the category of selection. I mean, that may be making the child another kind of product, not a toaster, but an organ donor. But I mean, I think in the instances where parents decide to bring to term the child who has anencephaly, I've heard a few different things. The parents want the experience of at least touching, looking at, holding the child. That personhood begins at birth for a lot of people. That the difference between the late-term fetus and the newborn is that the newborn is a geographically separate entity. The newborn can theoretically be taken care of by a whole range of people, mothers, fathers, nurses. In the instance of the child with anencephaly, it's going to be a lot of people, and it's probably not going to be parents so much. But the parents get some kind of social experience, however limited, of that infant. And many people want that. So they want to have some experience of life, even small, of seeing that child, of naming the child, of thinking of that baby as a child, not as a fetus. I mean, that's what I understand. Is it a selection? No, I don't think so. It's coming to fruition of that pregnancy. Is it making the? Is it defying Kant and having the child be used for other ends and not primarily for him or herself? I'm not sure. We don't know what the experience of life is for the child with anencephaly. Maybe there is some very gratifying minimal experience. I don't know. There's certainly some gratifying experience for the parent. So they get some tiny non-pregnant experience of parenthood.
So it's almost as if they're selecting not to select when they decide to have the child. So they have the option to select not to have the child, right?
Sure.
Okay.
All right. Thank you.